Good morning, guys. Have discussion A for you. The title is Lifeline for Caregivers. How aging life care managers offer relief to those facing burnout. Okay, so we're going to discuss that for A. So please join me for today's discussion A. Caregiver burnout is rising. AARP's 2023 report shows 40% of caregivers struggle with emotional stress from balancing work and caregiving. Over half report difficulty maintaining their own mental health. Role of aging life care managers, also known as geriatric care managers. They provide personalized care plans, resource navigation, advocacy, and expert guidance. Their goal: reduce caregiver stress and promote sustainable care strategies. Kate Granagan, she's a social worker, president of the Aging Life Care Association, emphasizes these professionals act as guides through elder care complexities. They help caregivers avoid burnout and maintain healthier caregiving approaches. This piece underscores the urgent need for structural support and professional guidance for family caregivers, something that aligns beautifully with your work on culturally responsive community-based interventions. If you'd like, I can help map how aging life care managers might be integrated into rural or underserved settings, or co-design a myth-busting resource around caregiver burnouts. Aging life care managers can be transformative allies in rural communities where aging adults often face geographic isolation, limited healthcare access, and fragmented support systems. Here's how they can make a meaningful impact. Navigation and advocacy. Bridge from fragmented systems. ALCMs help rural elders and caregivers navigate complex healthcare, insurance, and social service systems. Advocate locally. They liaison with rural clinics, hospitals, and community organizations to ensure elders receive timely coordinated care. Expanding access to care. Telehealth coordination. ALCMs connect clients to remote specialists and virtual care options, reducing the need for long travel. Home based services. They identify and coordinate in home medical and non medical services, including therapy, personal care, and medication management. Transportation solutions. They help arrange community based or, or volunteer transport for medical appointments and social activities. Community integration, build local care teams. ALCMs assemble network of primary care providers, pharmacists, and home health agencies tailored to rural settings. Support aging in place. They assess housing safety, accessibility, and connect elders with local programs for food, mobility, aids, and social engagement. System Systems level impact. Policy advocacy. ALCMs contribute to age friendly initiatives and advocate for resource allocation to underserved rural areas. Cultural Cultural adaptation. They tailor interventions to reflect local values, traditions, and caregiving norms, especially vital in tight knit rural communities. Would you like to co design a rural outreach framework or toolkit that integrates aging life care managers into your existing infrastructure mapping work? We could build a myth busting modules, telehealth readiness checklists, and even caregiver burnout prevention strategies. Here are several standout examples of aging life care manager aligned initiatives that have made a meaningful impact in rural communities, many of which align beautifully with your work on infrastructure mapping, caregiver support, and culturally responsive adaptation. One, PACE program in rural Kansas. Program of all inclusive care for the elderly. PACE offers wraparound medical and social services to older adults, especially those duly eligible for Medicare and Medicaid. Example, in rural Kansas, PACE teams include care managers, coordinate transportation, home health, and telehealth services. Impact reduces hospitalizations, improved medication adherence, and greater caregiver satisfaction. Telepsychology for elderly veterans, South Carolina. Need addressing depression in rural veteran with limited access to mental health care, intervention, behavioral activation therapy delivered via home-based telehealth results equal outcomes in equal outcomes to in-person therapy with improved satisfaction and reduced stigma. ALCM's role: coordinate care plans, ensured tech access, and monitored progress. Strong People Program, rural women's health focus, community-based strength training and health education for midlife and older women. ALCM's contribution: facilitate local partnerships, recruited participants, and adapted curriculum to cultural norms. Outcomes: improved cardiovascular health, reduced depression, and increased self-confidence. Livingston County Help for Seniors, New York. Innovation: EMTs trained in geriatric screening via videocasts and supported by care managers. Screened over 1,200 rural elders for fall risks, cognitive decline, and chronic conditions. ALCM's role: follow-up coordination, caregiver education, and linkage to services. National rural age-friendly initiatives led by NRHA and John A. Hartford Foundation. This initiative complies best practices for rural aging, including caregiver support, transportation, and dementia care. ALCMs are central to implementing these modules, especially in adapting services for diverse rural populations. Would you like to co-create a matrix that maps these modules into infrastructure gaps in your targeted regions? We could layer in cultural adaptation indicators, caregiver burnout matrix, and implementation feasibility. I'm ready when you are. Despite their promise, aging life care managers initiatives in rural areas face a cancellation of systematic logistical and cultural challenges. Here's a breakdown that aligns with your infrastructure mapping, and equality-driven lens. Give me 1 second, folks. Healthcare access and fragmentation. Sparse provider networks. Many rural regions are designed as health professional shortage areas, limiting collaboration opportunities for ALCMs, limited specialty care, geriatricians, neurologists, and mental health professionals are often hours away, complicating referrals and care coordination. Digital divide. Low broadband penetration, telehealth, and remote monitoring, key tools for ALCMs, are often inaccessible due to poor internet infrastructure. Tech literacy gaps. Older adults and caregivers may struggle with digital platforms requiring additional training and support. Transportation barriers. Few public transit options. Rural elders often rely on informal networks or volunteer drivers, which are inconsistent or unavailable. Isolation risk. Lack of mobility contributes to social isolation, missed opportunities, and caregiver strain. Workforce shortages. ALCMs scarcity geriatric managers are concentrated in urban areas, making recruitment and retention in rural settings difficult. Training gaps. Community health workers and informal caregivers may lack geriatric specific training, limiting the effectiveness of care plans. Cultural and structural barriers. Mistrust of outsiders. Rural communities may be weary of external professionals requiring cultural attuned engagement strategies. Informal caregiving norms. Reliance on family and faith-based networks can both support and strain caregiving ecosystems. Okay, guys, so that is A for you for this morning. I'll be back on later tonight with the second show for y'all. So I'll see you about 9 o'clock or so for a second show. For now, Gator Wellness. Take care, folks.